Welcome to the premiere disc video where you will learn how easy it is to sharpen the Columbia 1314 Universal Curette. We will review its intended use and the important parts of this instrument tip, as well as common problems to avoid in sharpening, and, most importantly, just how easy it is to use the disc sharpener for predictable sharpening results every time. All Columbia curettes are considered universal curettes. They are designed with two cutting blades on each opposite working end. The Columbia 1314 curette has a curved shape where the upper and lower shank meet above the working end. This pronounced angle along the shank provides better access in scaling surfaces throughout the entire dentition, but with greater emphasis on posterior teeth. The terminal shank is the lowest section of the overall shank, which is closest to the working toe. The Columbia 1314 curette has a shorter terminal shank when compared to the additional designs of the Columbia series. When comparing the differences between a scaler and a curette, you will find that the scaler has a pointed tip and triangular back to the working end, whereby the curette displays a rounded toe and smooth rounded back to its working end. When applied to each of the posterior teeth, the Columbia 1314 curette is inserted at a 0 to 40 degree angle and opened to 75 to 80 degrees to begin scaling. Begin at the distal line angle and scale the entire distal surface. Next, the opposite cutting edge is applied at the distal line angle with the toe forward. Scale with overlapping strokes across the buccal surface into the mesial surface. The most efficient way to complete a quadrant scaling is to begin with the most posterior tooth and continue moving anteriorly until you complete the quadrant. Switch to the opposite working end of the instrument to complete the lingual surfaces of the same quadrant. Repeat the same technique using both cutting edges as you move toward the anterior. Limitations when using a handheld stone include establishing precise angles and maintaining control, selecting the proper stone, increased chance of injury. Sharp instruments keep you at peak efficiency while minimizing physical stress. Your patients will appreciate an efficient procedure with greatest comfort to them. The Premier Disc Sharpener eliminates the need to remember which angles are required for each instrument design. The guesswork is eliminated because the settings are clearly marked on the disc wheel. It is easy to sterilize. The ceramic stones are ideal for maintaining instruments daily and require no lubrication before use. When sharpening a universal curette, there are two settings corresponding to each adjacent cutting edge on the same working end. For the Columbia 1314, the disc settings are uppercase letter J and lowercase c. Rotate the wheel so that the uppercase J setting lines up with the indicator line. Tighten the screw. Start with the number 14 working end and place the cutting edge on the front stone with the toe facing the wheel. The handle of the instrument is aligned parallel to the bold reference lines on the wheel. Then, simply move the instrument blade across the stone while keeping your wrist steady so the instrument remains aligned with the bold reference lines during the entire stroke. The final step requires the operator to roll the handle in a gentle grasp so that the curette is finished in a smooth rounding of the toe. Now, flip the instrument and position the cutting edge on the rear stone with the toe positioned towards the wheel. The handle is aligned with the bold reference lines and repeat the same sharpening step. To sharpen the alternate edges, change the setting on the disc sharpener to a lowercase c. Position the toe facing the wheel. Notice the handle is now below the stone and aligned with the reference lines on the wheel. When in this position, it is easier to hold the instrument in your palm. Move the blade across the stone, again rolling the handle for a smooth rounding of the toe. Flip the instrument to sharpen the opposite end on the rear stone. The handle is aligned with the bold reference lines and repeat the same sharpening step. Finally, take a test stick and apply the sharpened cutting edge to the stick to check for bite, as this indicates a successfully sharpened instrument. Regardless of whether you are sharpening a Columbia 1314 or more complex designs, the disc gives you complete confidence you are sharpening each instrument correctly for predictable, efficient results in clinical use. Premier utilizes Smart Sharp technology, a proprietary process for well-defined edges that are easy to sharpen. Premier instruments are available in a wide variety of handles: Light Touch, Big Easy, and Big Easy Ultralight. Big Easy Ultralight scalers and curettes offer the ultimate in ergonomics and comfort. The lightweight, large 1/2-inch diameter handle weighs up to 30% less than other instruments. They are surprisingly light. The handle is an advanced technology polymer with medical-grade silicone grips to offer exceptional lightness and durability. Premier has introduced many innovations in the area of instrumentation. These include the novel PerioWise color-coded probe, ideally suited for a quick screening or a full examination. Implant scalers made of graphite-reinforced resin have thin, sharp tips with well-defined edges to effectively remove calculus and plaque, but will not scratch implants. Since 1913, Premier has established itself as a world leader in dental instrumentation, utilizing time-proven procedures completed by skilled craftsmen, all in accordance with Premier's quality system. When you choose Premier, you are selecting over 100 years of experience in quality manufacturing. The family tradition is now in its 4th generation.